Oh my goodness. So I remember looking at my husband on the way. We were trying to get the emergency room as quickly as we could, and we thought we were probably just going to stop in Batesville since I didn't make it to my 37 weeks, and then get transferred on to Little Rock. So I remember looking at him and saying, "Oh no, we're going to have to go to Little Rock. I didn't make it 37 weeks." But we got to Little Rock, or we got to Batesville. We got to WRMC, and I was so far into labor that we had to go ahead and try it at WRMC. So we did, and it was a blessing. We got to stay at Batesville, and that was our wish and our goal, is to be able to stay in Batesville. And we had premature twins, and they had low birth weight. One was 5 pounds, and one was 4'7". And so we were in the hospital for 10 days, and our children were in the NICU, the neonatal care. And our little girl Harris, she spent 2 days in the NICU, and Davy ended up staying 7 days. And being away from home and trying to sleep in a hospital bed is hard. And not having your children in your room when you've just given birth is really hard also. But I knew that my children were being taken care of, and to me that was the most wonderful thing about my hospital stay, was that my children were getting one-on-one care with the OB in the OB unit in the NICU. And it just let us sleep at night, and just to know that our children were being cared for one-on-one. And there was literally one nurse per 2 children in the NICU, and it was the best care that I could ever imagine that my children were getting. And my husband and I have discussed this, and we really think that we would put the nurses and the staff in the OBGYN unit up against any in the state of Arkansas. And that is really good to know when you are a parent. So that was very important to us, that our children were being taken care of. And I think that being able to stay in Batesville was so handy because my husband, we're from Melbourne, we've lived in Melbourne our whole lives, and he could go home and sleep at night and come back, and he was well rested. And of course this was the middle of the night, spur of the moment thing, and I wasn't real prepared. So he was coming back and forth with supplies that we needed, and it was just a blessing that we were able to stay at WRMC and get the care that we did. And what I really think I can sum up our 10-day stay as, we really wouldn't have wanted to have been anywhere else.